Hello guys, welcome back to Pharma Palette. So today in this video, we will be discussing about two pharmacological classifications. So one is hallucinogens and the other one is the drugs for mania and bipolar disorder. So let's start with the classification of hallucinogens with the help of simple tricks. So to remember the subclasses under this hallucinogens, just remember one sentence which is I pray and chill, where I means it is indole alkylamines, P means it is phenyl alkylamines, A means it is aryl cyclohexylamine and C means it is cannabinoids. Let's try to see the tricks under each class. So in the indole alkylamines, to remember the examples under this, just remember one sentence which is LSD, psycho, harmed, dim brain. LSD psycho, harmed dim brain. And in the phenyl alkylamines, remember the trick as yaba mess. Yaba mess. And in the aryl cyclohexylamine, just remember cycle or cycle. And in the cannabinoids, remember it as THC. So coming back to the examples. So here, first one is LSD, which means lysergic acid diethylamide, which is also called as LSD. So lysergic acid diethylamide is LSD, that will be coming under indole alkyl amines. And next one is psychono. So just remember it as psilocybin and the other one is psilocin. So next one is harm. So the drug here is Harmin. And the next one is DIM. So remember it as dimethyltryptamine. Dimethyltryptamine. So lysergic acid ethylamide, psilocybin, psilocin, harmin, dimethyltryptamine, all these drugs will be coming under the class indole alkyl amines under this hallucinogens. And the next class is phenyl alkylamine and the trick is yaba mess. So here mess means remember it as mescaline. Okay, yaba means it is a drug. Methamphetamine and methylhexenamine, both together we will be calling it as yaba. So that yaba and mescaline comes under this phenyl alkylamines. And next one is aryl cyclohexylamine. So there is only one simple example which is phencyclidine. Phencyclidine. Next one is coming to cannabinoids. In the cannabinoids also there is only one single drug, that is THC. The full form of this is tetrahydrocannabinol. One drug which is tetrahydrocannabinol, which is also called as THC. Now let's get back into the next classification, which is the drugs for mania and bipolar disorder. So this class is only divided into three main classes. So one is the mood stabilizer. Second class is the anticonvulsants. And the third class is atypical antipsychotics. So in the mood stabilizer, there will be only one drug which is lithium carbonate. So lithium carbonate is a mood stabilizer. And in the anticonvulsants, just remember one sentence which is very calm life. Where V means it is valproate, C means it is carbamazepine, L means it is lamotrigine. Coming back to the last class, which is atypical antipsychotics, just remember one sentence which is old, rich, Queen Eri. Old rich Queen Eri. Where old O means it is olanzapine, R means it is risperidone, Q means it is quetiapine, Eri A means it is aripiprazole. So, this entire classification can be remembered with just three simple things. So, remember lithium, remember very calm life, and remember old rich Queen Eri. This entire classification can be remembered with this simple trick. So MAA, where M means it is mood stabilizer, A means it is anticonvulsants, A means it is atypical antipsychotics. So just with three simple tricks, one is lithium, very calm life, old rich Queen Eri, the complete classification will be done. So lithium means it is lithium carbonate, which is a mood stabilizer, is one of the class under this drugs for mania and bipolar disorder. Coming to the second class, which is anticonvulsants. So here remember very calm life, where V means it is valproate, C means it is carbamazepine, L means it is lamotrigine. And coming to the last class, which is atypical antipsychotics, remember old rich Queen Eri, where old O means it is olanzapine, R means it is risperidone, Q means it is quetiapine, A means it is aripiprazole. That is all about the complete classification of hallucinogens and the drugs for mania and bipolar disorder. If you found this video helpful, don't forget to like, share and subscribe to Pharma Palette. See you all in the next video. Thanks for watching.